Welcome everyone to the second day of the Global Child Nutrition Forum's virtual conference. We're excited for everyone to join again today for our first technical panel on the importance of nutrition. Before we begin, I would like to note that this session will be presented in English, and there is the option for live French interpretation. If you would like to access the French audio channel, you will find a globe icon in the bottom menu bar in your Zoom screen that will allow you to change the channel from English to French. Additionally,
de l'anglais en français. En plus de cela, il y a un autre icône qui vous permettra donc de changer la langue.
Be sure to submit those into the question and answer function, and our production team will follow up with you. Now, I would like to introduce our moderator, Ms. Catherine Bertini, Distinguished Fellow with the Chicago Council on Global Affairs, who will be moderating this session and introducing our session panelists. Thank you.
Thanks very much, Ryan, and hello to all of the participants in the forum from all around the world. I know this is a very different forum than in the past, but I also know that the program that is before you, starting yesterday actually, is chock full of very interesting information, and hopefully the training that you get is as good or better as you would have gotten in person. The networking, of course, we have to work on a bit more being virtual, but welcome. So I'm very pleased to introduce our panel today, starting with our first speaker. Miriam Shindler is at the Global Alliance for Improved Nutrition, and she is leading the Better Diets for Children program. So she focuses on building food systems that are good for children and that understand the specific needs of children. Her background is very appropriate for that because she worked on similar kinds of projects for the Association of Girl Guides and Girl Scouts. And Miriam, I would be one of your people if many generations ago as a Girl Scout in the USA. She also worked for CIMMYT, the International Maize, Wheat and Improvement Center. And all of her experience really lies in this intersection of food systems and childhood. So we're really fortunate that Miriam has joined us and can share some of this, some of her wealth of knowledge today on this panel. Miriam, you have the floor.
Thank you very much. Let me just share my screen from my end. Just give me 1 second. Okay, can you see my screen just before I start? Great. So thank you very much, Catherine, for introducing the warm welcome. The wonderful thing about the Girl Guides and the Girl Scouts, as well as the Boy Scouts, it's really an international network, and you always meet somebody who's been involved. Just also like to say a warm welcome to Fatima and to Yannick, the other panelists today, and to everyone joining this session from wherever you are in the world. So I'm here representing GAIN, the Global Alliance for Improved Nutrition. We work with governments, businesses, and civil society to transform food systems so that they deliver more nutritious food for all people. Now, as Catherine said, my role at the organization is to make sure that food systems deliver more nutritious food for all children. So I'd just like to thank my colleagues at GAIN for inputting into this presentation, and especially Dr. Lawrence Haddad for some of the background information. So with the theme of new challenges and opportunities for ensuring access to nutrition, I'm going to be focusing on really looking at this from a food systems perspective. What impact has school closures had across the food system? And what do we know about some of the potential challenges that are arising because of COVID-19 and the lockdowns, and especially how they relate to school-aged children? So I just want to begin by introducing you to the Standing Together for Nutrition Consortium. For those that might not be aware, this is a multidisciplinary consortium of experts from across nutrition, economics, food and health, really trying to assess the impact and the scale and the reach of COVID-related nutrition challenges. So if we look at this diagram here, and we kind of look at the side and think, how do we think COVID-19 might impact malnutrition? There's really kind of three areas that have been identified. Those impacts from the economy, from food systems, and health systems. We anticipate nutritious food to become less available and affordable, but at the same time, the prevention and treatment of illnesses will become harder, will become more challenging. This has a direct link on both dietary quality and illness, and the costs to society already are huge. And for those of us kind of going into a second wave of COVID-19, this is only going to increase, and this leading to an increase in all forms of malnutrition. Now, if we look specifically at children, so I'm just trying to hide my the controls so I can see my screen a bit better. Thanks. So, in July 2020 of this year, the Standing Together for Nutrition Consortium published a study in The Lancet looking specifically at wasting among children under the age of 5 in low and middle income countries, and modeled what the impacts could be to make recommendations to help mitigate the damage. Now, it's estimated that there could be an additional 6.7 million children with wasting in 2020. Now, I just want to remind you, this is just one indicator that we're looking at. So just try and think what this would be if we looked kind of at malnutrition more broadly. Now, of this 6.7 million children, 57.6 are estimated to be in South Asia, and 21.8 in sub-Saharan Africa. So just to give an idea of where the geographical breakdown would be. So as I said, kind of coming from GAIN, looking at this as kind of from the food systems perspective and understand how we ensure access to good nutrition, especially with school closures, throughout various types of lockdowns and just the ongoing pandemic. This is a good opportunity to introduce what we call the Innocenti framework. Now, this was developed by GAIN and UNICEF last year with a lot of partners. You may have seen this featured in the State of the World Children publication as well last year. And it's really looking at, there are 4 key determinants that come together really to determine what do the diets or the nutritional status of children and adolescents look like. None of these exist in isolation, they all are interlinked. We have the food supply chains that you'll see in green. This is where our food is produced, where it's stored, how it's processed, and even where it's sold. We have our external food environments, and this is where schools come in. This is where we might buy food or eat food. We have our personal food environments, which inform how accessible is food to us or how affordable it is. But we also have our behaviours as caregivers, but also children and adolescent behaviours as well. Now, often people will say, like, well, what is a food system? And I like to think of a food system as being everything from where food is produced, where it's consumed. We all eat, we are all part of the food system. So what happened across the food system then when schools start to close? So if we think about this as in our external food environment, from the supply chain side, this had a direct impact on the production of food and retail and markets. I'm going to bring in a kind of case study from our work in Nigeria in a minute, but seeing surplus at the farm level, small SMEs unable to sell because, schools are a large procurer, or, governments would be a large procurer. And if you take away schools, they're losing a large part of their business. But we also saw that on an individual level, that the closure of schools also had a change in the behaviours of the way children and adolescents were eating. In some respects, this took away the accessibility of food and the convenience of food for them, but it also changed who had autonomy over what they were eating, when they were eating, and who they were eating with. So to bring in this example from Nigeria, to give a little bit of background first, so GAIN is working in Kaduna State, in one of the states of Nigeria, where there is a national egg production initiative. Now, this secures 1 egg per week in school as part of school feeding programs for all children aged 5 to 9. This also helps to link education and food systems by strengthening egg value chains through national homegrown school feeding programs. If you want every child aged 5 and 9 to have an egg, you need to make sure that there's enough egg supply to feed them. So kind of coming along, GAIN wants to say, well, how do we make sure that actually we're reaching children that are not yet in school? So really thinking children under the age of 5. And how do we also promote positive consumer behaviour and generate demand for healthy foods outside of school, but making sure that they're linked to school feeding programs? So with the existence of this National Egg Production Initiative, GAIN set up the Eggs Make Kids campaign. Now, this is a campaign in Kaduna State that utilizes commercial marketing methodology, uses a range of communications approaches to generate demand for eggs as an animal source food. It works in school to kind of work with school-age children about the importance of eating eggs, but also works with caregivers in point of purchase at the market, in their homes, even in hospitals, to promote eggs as a nutritious food. So what happened when schools closed? Well, the first thing that we saw was an increase in egg surplus at the farm level. Without the government procurement for eggs, this had a direct impact on the egg supply chain. But at the same time, local markets were reporting egg shortages because of blocks from the lockdown. So GAIN and partners came up with this very short-term solution, which is the egg mobile truck, which is the picture that you see here. And this was intended to bring eggs from farm to market, and it also doubled up as a promotion tool. It helped to prevent SMEs in nutritious food from going out of business, so really thinking about that green part of the framework, which I introduced earlier, but it also helped to get animal source foods to school. This was a really successful short-term solution, but not something that we would see as taking to a long-term solution, because especially not wanting to kind of cut out the retailers by bringing eggs directly from farm to consumers. But it also brought up a really important challenge that we hadn't anticipated about this is really a kind of break in the egg supply chain in Kaduna State, and has made us think about, well, if we're working on future projects, this is an area, should this be an area that we're working on? But if we also think about the effects that COVID-19 has had on school-age children's eating habits and on their, their accessibility to food, we know that as children get older, who they eat with, how they eat changes. So they gain more autonomy over their diets. They eat at school, they eat with peers, but this also comes with some risky behavior. So this is where increased snacking happens. There's much more peer influence on food choice as well. So in Pakistan, and I'll just pause for a minute here, a silver lining. I think any of us that have personally gone through school closures with our own children will struggle to find any silver lining in it. And I think if we've seen the widespread challenges of school closures on children's diets, it might be hard to think of a silver lining. But this is one area where we actually saw it as an opportunity to improve children's diets. So in qualitative research done by Ipsos for older school-age children in Pakistan, so these were children aged 10 to 14 and 15 to 19, what we found was that the most vulnerable part of a child's day, and these are older children, was snacking. When the meal was, let's say, controlled either in school or at home, it was fairly healthy. But when it came to when children can make that decision themselves, and this is really like what this research was looking at to understand the motivation and barriers to good nutrition among adolescents, they talked about snacking. Snacking for them was a pivotal part of the school day. It was about how they socialized with friends. It was about what they could buy on the way to and from school. That when they had after school tuition, it was a way that they would socialize with each other. And they defined snacking as really what made them a teenager. And what was interesting as well is that when we looked at this across different economic groups, even those in lower economic groups said, well, actually, we may not have a lot of additional money to spend, but when we do, we want to spend it on snacks. So what we saw with COVID was it actually resulted in a reduction in snacking in older school-age children in Pakistan. That they really talked about the big challenge for them of not having school and not having that routine anymore. And I think, we're all well aware of what impact COVID-19 is having on children's mental health. But the one thing that we did see as a positive was that it reduced snacking in older school-age children. And this made us think, is this actually a long-term opportunity to promote the consumption of healthy foods across school environments? And I say school environments here rather than just the school, because it's really what is sold both in and around schools. And especially here, the snacks that these adolescents were talking about was mainly bought on the way to school from small shops or from vendors. So to come back to that very initial slide where I presented the increase in, what's been modeled as the potential increase in wasting. We really know that wasting is just a leading indicator, and it's the tip of the iceberg. So if we look underneath the iceberg and we think back across the food system and we think back about blocks in supply chains, we think back to how it's changing our own behaviours, children's behaviours, we really know that actually there could be increases in stunting, in micronutrient deficiencies, in obesity, and even lives lost. And so really saying that, the time to act is now. But what does acting now actually mean? So if we go back to that Lancet paper, there was also another letter in the Lancet that was authored by the heads of the four main UN organizations, dealing with COVID and food. So this would be UNICEF, WHO, WFP, and FAO. And they've identified 5 things that need to happen to really ensure access to good nutrition. This is that we safeguard and promote access to nutritious and safe, affordable diets. We invest in improving maternal and child nutrition, a big focus on child wasting, about reactivating and scaling up services, but maintaining provision of nutritious and safe school meals, and especially for the most vulnerable, and that we expand social protection to safeguard access to nutritious diets. So just to conclude, unchecked, COVID-19 and lockdowns, they threaten to reverse 10 years of progress in 10 months. If you look globally, the malnutrition rates, let's say, if we look globally, rates of wasting and stunting are going down. This, based on modeling and what we're looking at, it threatens to reverse that. So we need to protect all types of nutrition, and I would include overnutrition here for the very youngest. We've talked about school-age children, but we also need to think about children that are not yet in school. We need to think about childcare as well, and the provision of meals at the childcare level. The impact of school closures is being felt across whole food systems. SMEs that would be supplying food to schools, that's putting their business at risk. But it's also led to some surprising challenges. We saw in Kaduna State, Nigeria, it really made us think about this link between market and retail, or this link between farm and retail that we'd never really focused on before, and thinking, well, that's an area of the food system that needs to be sustained. But it's also brought with surprising opportunities, and I would emphasize, what we saw in Pakistan as one of those opportunities. Dr. Lawrence Haddad, I borrowed this from him. He says, is it a sting in the tail or a chance to remake our food and nutrition systems? And we really see that as both. I think for many of us, COVID-19 has been a moment to stop and to reflect. And as much as we can reflect on that personally, it's also for us to reflect on our food systems and say, how is it that we want to transform our food systems, and what are the challenges that we need to be overcoming to get there? But what we've really seen is that a lot of this has been short-term opportunities. It's been very reactive. We've kind of had an immediate challenge where we've had to find a solution to, but we really need to be focusing now on turning these into long-term solutions. And finally, it's really about thinking about improving food in and around schools, and that food environment as well as school meals. Bringing back that example from Pakistan, we really saw that actually in schools, it was much easier to kind of make sure that children were eating healthier diets. But as soon as children were out of school, that is where snacking increased. So it's really about thinking more broadly about school environments, thinking about what is sold to children both in school and around
autour, ce qui est vendu aux enfants, ce qui est proposé aux enfants dans les écoles et aussi autour des écoles afin de pouvoir arriver à une situation long terme. Donc, je voudrais vous remercier tous pour m'avoir écouté. Merci de m'avoir invité.
Email me if you have any follow-up questions. Back to you, Catherine.
Miriam, that was brilliant. That was brilliant, Miriam. Thank you so much. And it's going to be a really important contributor toward our discussion here. And especially toward those last few points at the end, I think when you talked about using these opportunities for the future and for rethinking our systems, it is so critically important that we do that. Right now, we're coping and learning, but now the next steps are going to be actually doing and creating more viable systems over the long term. So thank you. That was a really wonderful beginning for us. Yannick Foing is next, and he's the Global Director of Nutrition Improvement at Royal DSM. And he not only has that background now, but he was the Director of Partnership for BioVision of the World Life Sciences Forum, which is a nonprofit think tank. When he left there and joined DSM, he was working on food fortification, and he also has a priority for underserved populations, especially poorer populations, and has been part of a partnership division since 2018. So he also has a lot of experience to bring us, and we look forward to hearing what he has to say now. Yannick, you have the floor.
Thank you, Catherine. And great presentation, Miriam, and really, really interesting. Can you go to the next slide, please, Ryan? Thank you. So I'm afraid I'll be repeating a bit what Miriam has shared, but prior to the pandemic, almost 1/3 of the global population was already suffering from diseases linked to micronutrient deficiencies. And I think there is now, unfortunately, no doubt that COVID-19 is deepening malnutrition around the world, and with the worst consequences borne by children. Also with severe effects as well on productivity and socioeconomic development. Not a single country today is untouched by the pandemic. And lockdowns that have been put in place to mitigate the spread of the virus, combined to the disruption of health services, could end up doubling the number of people suffering from food insecurity, and drive up multiple forms of malnutrition, as Miriam highlighted, including wasting, stunting, maternal malnutrition, and evidently micronutrient deficiencies. So we see that the largest COVID impact is coming from issues linked to access to food and basic supplies and services. Lockdowns and travel restrictions have completely disrupted food supply chains and are now limited access to nutritious food, especially for the poorest of the poor. In addition, the current pandemic has completely disrupted the delivery of supplementation programs, like vitamin E supplementation, for instance, which are making children even more vulnerable to preventable diseases and malnutrition. So if we go back in time, I mean, by mid-April, lockdowns were already keeping close to 94% of school children worldwide out of school, half of them being girls. So not only these children are deprived of their regular education, but we all know that it's at school that children, and especially the poorest, are getting vital nutrition and the health support allowing them to learn. And school meals constitute one of the most reliable daily sources of food. These school meal programs make really a tremendous contribution to the daily nutrients intake of children. And we all know that in the poorest communities, schools are typically among the most important structures of support, where children can access incentives, both financial and non-financial. And so without the school platform and without the access to school meals, obviously hunger and micronutrient malnutrition are exacerbated for millions and millions of children and their families. And that's really affect their chances of recovering ever from the COVID crisis. So what we are also seeing on our end is that people are now turning to staple foods as they cannot afford anymore to consume a diversified diet, which usually includes fruits, vegetables, meat, and dairy, for instance. So staple foods like rice, wheat and maize-based meals are providing calories, are filling stomachs, but as we all know, they are unfortunately poor in essential vitamins and minerals, which are now really needed to strengthen the immune system and to make populations, and particularly children, more resilient to the pandemic. And this is not an issue that we see only in low to middle income countries, but also in Europe. I mean, I'm sure you heard the story about the UK, and also in the US as well, where I believe in a typical year, the government helps feed almost 30 million school kids a day. So about 1 out of 2 kids in the US. And now, because of COVID-19, most districts in the US are delivering only half as many meals as before. So without the right action, the deep impact of the pandemic on early life nutrition could have really intergenerational consequences for child development and really impacts on education and overall on human capital. Next slide, please, Ryan. Thank you. So as I mentioned earlier, I mean, we now see a significant increase of consumption of staple food, and mainly because of budget reasons. And staple food represents exactly what it says. It's the most essential basic food available on everyone's plate. And right now, in the case of the billions of people living, for most of them, in the lower part of the economic pyramid, that's pretty much the only one food that they can really rely on having on their plate when nothing else is available. And as I said earlier, so even though such foods may contain sufficient calories, they lack the crucial nutrients that are necessary for good immunity. That has been proven so critical at this point of time. And in the current context, fortifying staple foods such as maize or wheat flour-based meals, rice, obviously, edible oil, with essential vitamins and minerals, that becomes even more important than ever to really help to make a more nutritious diet affordable and available to all. So I believe you all know that fortification is inexpensive and efficient way to really increase the vitamin and mineral content of food that people consume every day. If done really properly, it has the potential to improve diets across the entire population, including children, obviously. It's highly accepted because it does not impact.
En particulier les enfants, c'est bien accepté parce que ça ne dénature pas le goût. Hein. Donc c'est vraiment une façon très bonne en termes de prix. Hein, si on regarde le retour sur investissement, il y a différents types d'estimations, mais de façon assez bizarre, générale, $1 investi donc peut rapporter $27. Donc vous pouvez voir vraiment c'est très important. Hein. C'est encore au-dessus de l'immunisation. Hein. Donc il y a eu plein de succès dans le passé hein, sur ce type de choses-là. On a pu analyser les succès sur près de 100 ans. Alors, en particulier des études avec les enfants. Par exemple, l'acide folique, le zinc, le fer pour renforcer les os ou autres qui ont vraiment réduit les déficiences chroniques. Et encore une fois, au niveau de la prévention, c'est très important. Et si vous prenez l'exemple spécifique du riz, le riz, c'est maintenant le féculent le plus consommé sur la planète et ça représente à peu près 50% des apports journaliers moyens pour près de 50 millions de personnes. Hein. Avec la technologie que l'on a disponible, par exemple, pour différents produits, il est maintenant possible d'ajouter des nutriments au riz qui ne sont pas dans le riz à la base afin de...
And there are a lot of scientific evidence and clinical studies showing the impact on fortified rice on critical deficiencies and also on cognitive development in children. We have now guidelines to fortified rice from WHO since 2018, and rice fortification is mandatory in now 7 countries. And it's already being used successfully in quite a few school feeding programs in countries like Bhutan, India, Myanmar, and Cambodia, for instance, and soon, by the end of the year, early next year, in West Africa as well. So school feeding, as we know, is a great way to fill the nutrients gap and to really boost children's immune system. But I really believe that we need to move from feeding only children to nourishing them by really ensuring that we provide them with the nutrients-packed meals. And of course, I mean, just to come back to what Miriam said earlier, we have to look at innovative approaches with the context of the school closure. But also we have to ensure that we create systemic and sustainable change, which will last beyond pandemic to really improve resilience. And today, by incorporating fortified foods into school meals, we can really increase access to micronutrients, which are essential for children's immunity. And just one last remark on cost, because we often hear that fortifying school meals could be expensive, but actually effective fortification is very affordable. If I recall correctly, the incremental average cost per person per year fortifying wheat flour with iron and folic acid is only 12 cents. 12 cents per year per person. When you look at the benefits, should be a no-brainer. Next slide, please, Ryan. Next slide, please. Thank you. So micronutrients play a role in many organ functions, including those of the bones, skin. Slide before, please, Ryan. Thank you. So including the bones, the skin, blood, lungs, brain, or even the nervous system. And many of the micronutrients are also essential for the development and functioning of the immune system. So adults need to consume them to maintain good function. But pregnant women and growing children have much higher needs to really meet the demand for growth and development and the immunity of a child, for instance. And nutrition and infectious diseases are completely interconnected. On one hand, poor nutrition predisposes individuals to catch diseases and to really suffer more severe consequences. On the other hand, nutritious diets that contain the right amount of micronutrients, such as vitamin A, vitamin D, and zinc, really help to strengthen the immune system and really help also children to fight infectious diseases like the current pandemic we are living through. And throughout the life cycle, micronutrients are critical to the immune system function and to resilience to infectious disease. As I mentioned earlier, I mean, large-scale staple food fortification is a really, truly important tool to fight malnutrition in general, and even more now during the global pandemic, as it can deliver the immune micronutrients that we need to strengthen our collective ability to fight and recover faster from infections. Right now, it's clearly unacceptable that fortified foods are not more widely available. So we have access here really to a low-cost, proven, highly accepted, high-impact tools. And with those, we can really boost immunity, prevent diseases, generate massive economic returns, and dig up saving lives. So next slide, please. So initially, the COVID response was mainly about hunger, I would say, not so much about nutrition. But that's changing, as you can see on this slide. And as many agencies are coming together with recommendations and calls to action. We have a WHO guidance on diet in the current pandemic, which states that good nutrition is crucial for health, particularly in times when the immune system may need to fight back. And Miriam mentioned earlier the Standing Together for Nutrition Consortium. They clearly highlight in their recommendation the importance of strengthening large-scale food fortification and ensuring that by working together, we first and foremost do everything to safeguard affordable nutrition access to all, with specific attention to children and women. It also mentioned in the guidelines, that in the recommendations, that we should work also to maintain the provision of nutritious and safe school meal for children through home delivery, take-home rations, and cash and vouchers when schools are closed. And that fortified rules needs to be part of social safety net, especially for the poorest of the poor. But as Miriam shared earlier, I mean, there's also a silver lining somehow. And I believe that with the COVID crisis also comes an opportunity, not only to protect what has been achieved in terms of food fortification, but to really scale it up, to increase its reach even further. And it's also supported by the fact that we see as well raising awareness from people throughout the socio-economic pyramid of the importance of good nutrition to boost your immune system, which then translates into demand for fortified food. Next slide, please. So despite the challenges which are brought by the pandemic, many countries are taking action to expand and protect access to fortified food, really recognizing their importance to keep them available and accessible in the time of pandemic. So many actors are now looking at how to make food systems and essential social safety net, like school feeding, as pandemic resilient. Like how can we find alternatives to bring nutrients-packed meals to schools and to people who need them the most when the schools are closed. And Miriam showed us a great example earlier. So I just wanted to highlight quickly the experience of India. So instead of pausing and really stopping food fortification because of economic reasons, the Indian government actually decided to press on. And they are now looking into making mandatory fortification of oil and milk with vitamin A and D, which, as I showed earlier, are two critical immune nutrients. The Ministry of Food is looking at expanding the distribution of fortified rice, rice which is fortified with iron, folic acid, and vitamin B12 through the PDS. And there was also an announcement the last few days that rice fortification could also become mandatory in India in the coming 3 years. So changes also have been brought about in the targeted PDS, which include provision of staples like rice or pulses, and ensuring that they could be home delivered to vulnerable population. All that free of cost, obviously. So India, like other countries, have also looked into ways to provide nutrition to children during school closures. And in place of school meals, they have worked with partners to provide take-home rations, vouchers, or cash transfers to children. In other countries, mechanisms have been developed to deliver fortified foods to the children's household whose schools are shut. In some countries, like the US, we even saw school buses delivering fortified meals. Next slide, please. Last slide. So to conclude, globally, fortification provides essential nutrition to millions of children at risk of vitamin and mineral deficiency, really strengthening their ability to fight off infectious diseases. In a time of pandemic, fortification really serves as a vital nutrition safety net for millions of people worldwide. So food fortification programs must be strengthened and protected during the pandemic to really support the healthy immune system. And I believe we are in a critical window of opportunity to create sustainable change. So I think the long-term opportunity is the increasing awareness and the prioritization of nutritious school meal by government. Governments are increasingly recognizing the critical role of nutrition as part of school health program. And I think the opportunity for now is to help government to find ways to support school children get their meals during the pandemic. So I think there is no best vehicle than school feeding to improve children nutrition. And to be well nourished is really the foundation of opportunity. And I'm really insisting on nourish. So we need to ensure that we don't only feed, but most importantly, nourish children with nutrients-dense food. And I think this is now more important than ever. So if I recall correctly, the GCNF 2020 forum tagline is the new world of school feeding. So I would really like to encourage all of you attending to really join forces, to really break boundaries, to think about entering unlikely partnerships so that we can develop together a new world which won't only be feeding, but mainly nourishing children. So with that, thank you, and looking forward to a panel discussion. Over to you, Catherine.
Thank you very much, Yannick. And this new world for school feeding, this is a great, another great way you've ended in terms of having us think more about, and in a different way, about this topic. So that match with Miriam's conclusion, I think will bring us to some good discussion in a little bit. I thank you very much, audience who've been sending in some questions. We already have, and we'll come to them when we're done. We'll sprinkle audience questions in with some of my own. So we already have one for Miriam and two for Yannick for the future. So Fatima, Hachem, welcome, and thank you for being here. Fatima is the Senior Nutrition Officer at the Food and Nutrition Division of the Food and Agriculture Organization, sometimes known as FAO, sometimes known as FAO. Maybe the only UN entity with its own word, as opposed to a bunch of made up a bunch of acronyms, but as opposed to acronyms. She's the team leader for nutrition education and consumer awareness at FAO, and she focuses on 5 areas, and the most relevant to us are school food and nutrition, and professional training in nutrition education, and also promotion of sustainable and healthy diets. I certainly hope, and I'm sure many people do, that another one of the learnings that we can all have from the pandemic is that we can learn better about how to promote nutrition education and better about how to promote the right things to eat, especially when people have limited income in order to purchase that food. Fatima was also at FAO in the Near East region in Cairo, and before that she was a senior lecturer at universities in the UK and in France. Fatima, welcome, you have the floor.
Thank you, Catherine, and good afternoon to everybody, or good morning, wherever you are. Well, after the excellent presentations given by Miriam and Yannick, I will be actually going back to some global issues, perhaps to, let me see, can you see my slides? Yeah. Okay, so I will be presenting on school food and nutrition in a context of increasing hunger and malnutrition. Of course, COVID-19 has come to us as a shock that is not comparable to any other shocks that we have known in our recent history. But before we talk about COVID, I would like to present to you some data about the context, the global context in which we are operating. As many of you know, UN agencies, FAO, WFP, WHO, IFAD, and UNICEF every year produce a document, a very important report on the state of food security and nutrition in the world. And in this year's report that was launched in July, I can summarize few of the findings of the report that I invite you all to read. We have an alarming global context before the onset of or the arrival of COVID upon us. The world was not on track to eradicate hunger. The numbers of hungry people in the world were up by 10 million people in 1 year, from 2019 to 2020. And in 5 years, we have seen an increase in 60 million people being hungry. So the report estimates if recent trends continue, then the number of hungry people would surpass 840 million by 2030. So this is an alarming situation. Previously, we were making gains on reducing the numbers of the hungry, but then these gains were being lost little by little. But this year was particularly important, like between 2019 and 2020. The report also showed that over 2 billion people don't have regular access to safe, nutritious, and sufficient food, and that COVID-19 has posed another serious threat to food security. So the pandemic is estimated to add as many as 132 million people to the total number of hungry people in 2020. So we are facing a very challenging global situation. COVID has magnified the problems our food systems were suffering from, and COVID put us in front of a very serious reality. So in relation to malnutrition, we were also making gains, but we are not also on track to meet the sustainable development goals in relation to malnutrition. So while we have seen progress in child stunting and in breastfeeding, we are seeing increasing numbers and percentages of overweight among children, and adult obesity is not decreasing either, it's rather increasing. So, so against this background, I think that COVID has shown us that we have more than one problem to deal with. Children living in contexts that are defavorized or, let's say, challenged have seen more difficulties, not only because of the school closure, but because also the livelihoods of their families, the context in which they're living was all becoming more fragile. So On another hand, the reports showed us that more than 3 million people in the world cannot afford a healthy diet. So if we are talking about nutrition, we want people and children, of course, included, to be able to have healthy diets. But in fact, before the COVID, there was a problem of ensuring healthy diets for 3 billion people in the world, because economically, healthy diets were expensive. The report spoke or analyzed 3 different scenarios. A scenario where we are looking at the energy adequacy of a diet, and then nutrient adequacy, and a third level, which is diversified diets that Yannick referred to. So the cost increases by going one step up in the ladder to reach the diversified diet. So we have a serious problem there because of economic inaccessibility of healthy diets, which makes it very important to think about strategies and policies that could make healthy diets more available and accessible. So with that, the report recommended that we need to look at the problem in a holistic way. We need to transform the food systems to reduce the cost of nutritious food and increase the affordability of healthy diets. This becomes even more important in the context of COVID-19, knowing that the most vulnerable have seen their livelihoods being eroded. So how could we make these two ends meet? Like, people's incomes and livelihoods are being threatened because of this pandemic, and also before reaching this pandemic, they were anyway vulnerable. So policies or way forward or recommendations were given in the report. And there was an insistence on making policies and incentives more nutrition sensitive in terms of investment, and that policies across the food supply chains need to enhance efficiencies so that a better impact can be observed. And we also have seen that the international and internal trade policies needed to be more efficient, and marketing mechanisms needed to be rethought. So these are coming all together. But of course, nutrition-sensitive social protection remains one of the important options for us to mitigate the situation. And Miriam referred to the behavioral change, but this is a very difficult recommendation to implement in the short term. So this is something that we need to work on together so that we can reach that level that we aspire to on behavioral change. And then dietary patterns need to be encouraged that have proven to be healthy, but also healthy to humans, but also to the environment, because another concern that we are not talking about here, but is really a major concern for us in FAO and for most of the development agencies, is how do we make the two optics meet between health, promoting healthy diets and diets that are healthy and sustainable. So there's no harm to the environment, and they are socially and culturally acceptable and economically feasible. So these are the problems that the report, the SOFIA report, highlighted, and the way forward or the recommendations that were in the report. Now, within this context, we see the schools as an opportunity for this transformation. So schools, of course, it has been said, I'm not going to repeat it, that they are an excellent platform for making this change, and for making this change for the children themselves, but not only. In FAO, we think of the school as a perfect environment for achieving more than one SDG. We see the school-based nutrition programs and food programs as the triple duty action that can do more than or serve more than one objective at once. So how do we see this? And I will be presenting to you our vision that we think is very important in a situation of crisis like COVID or other crises to keep in mind, because the short-term interventions will not be enough to deal with a problem as big as the problem we are seeing now. So we need to keep the holistic approach in mind and see the schools as a small system that is connected to the bigger system, which is the food system where they are. So our vision of a holistic and synergistic approach to school food and nutrition programming is really based on 3 pillars that are working together, not in parallel, but together to reinforce each other. So we are thinking about the pillar of inclusive procurement and value chain that is very important in the case of school food and nutrition programming and also school meals. We are thinking of how the environment in the schools should be healthy. And then, of course, the nutrition education is part and parcel of this, but also the enabling environment. So it is a 4-dimension model, but which integrates other cross-cutting concerns and priorities like social protection, like gender, like reducing food losses and waste, and making food safe, and being economically and socially sustainable, and of course, being built on partnerships. So what is this approach that we are trying to promote in times of crises and in times of normal or perhaps business as usual situations? It's an approach that is, as I said, holistic in nature. So by holistic, we mean all these pillars working together to support the school community. So for inclusive procurement and value chains, what we mean is that the procurement aspect will provide school meals that are safe and nutritious, diverse, acceptable, and locally produced to the extent possible. And this means that priority is given to the local supply chain from smallholder farmers and from SMEs. And also within the same thinking or angle, we are talking about creating markets and financial opportunities for local smallholders and businesses to contribute to community and economic development. We cannot see the meals as separate from this reality, because this is one way of making the meals sustainable, and this is one way of making the community more involved in the work in the school outcomes and in improving nutrition. So this is when it comes to the procurement side. When we're talking about the healthy food environment and the school food in its totality, we want to make sure that food that is available in the school is safe and is aligned with the nutritional priorities and the needs of school children and adolescents. So it's not like each context will be different, and we need to make sure that what we are providing is adapted to the context. And when we're talking about the environment, this was said again by Miriam, we are talking about the school and around the school and beyond to reach the families as well. So these are important aspects to keep in mind. Nutrition education, yes, it's part and parcel of the whole package, because if we do not work with children to build their capacity and the skills and improve their practices that stay with them for the whole the rest of their lives, then we haven't achieved much. The information that is given in a certain instance or environment, and that doesn't affect the behavior, is not for us a good definition of nutrition education. So we are looking at that change in behavior and in building the capacities of students to be able to themselves make the right choice and be the agents of change. So agents of change not only for themselves, but beyond that for their systems and through for their families and communities, and through that to the bigger food system around them. And of course, nothing of this will work if we do not look at the enabling environment. We have seen it even in the situation of COVID-19. We have seen that some countries were very fast in looking at their legal systems and institutional frameworks to make procurement and distribution of the meals possible, and that needed a change of the policy and institutional and legal framework. So this is where long-lasting impacts can happen if we can change the mentalities and the way of functioning of institutions, and also have the supporting legal system behind us. So this holistic approach will not be possible if we don't involve the community. Yes, within the COVID-19, if we do not, if we think of the school meal as only a source of feeding, then we would have lost a lot of opportunities. We need to consider the community at large. We need to have the community part of the solution. We want them involved, and we want them actively involved and not passively involved in order to produce a change that is long lasting. We need to think about the local context and give it enough consideration, and also understand it and understand the bottlenecks. Last week, there was a study that was published in France by INSERM, and it showed that most of those who were affected by COVID-19 as families and as individuals were those who were living in poorer settings. So the socio-cultural, economic context is very important. There are, we know that COVID did not hit people in the same way. There are people who are more vulnerable than others, and we need to understand these vulnerabilities because it trickles down to children, and it's not only affecting the grown-ups and adults in their households. And this cannot be done without partnerships. We are talking about a school meal, we are talking about your nutrition, but your nutrition is not only about access to food. It has many other underlying causes, and we need to look at the system in its totality: healthcare, social protection, education, and also the immediate access to food. With that, I thank you very much, and I hope that the message of not treating the COVID-19 as a special case, but think beyond the emergency situation and how we can make a transformation in our systems to serve the cause of children better, and also build on the community participation and the linkages. Thank you very much, and I will, in my last slide, I share with you the URL link to our publication on FAO School Food and Nutrition Framework, where you will have more about this vision explained. Thank you.
Thank you very much, Fatima. We have about 15 minutes for discussion, and so I'd like to start that now. And as I said, we'll go back and forth a bit between the questions that have been coming in from participants as well as some of my own. And since 3 people, Yannick, this goes to you, have asked questions about the price of fortified food and the hurdles caused by the increased prices in the marketplace of fortified food, maybe you could address how to get over that issue and how to be able to make this food available to all. And interestingly, this came in from Asia and from Africa. in at least 3 different questions. Yannick, you have the floor.
No, thanks, Catherine. And I think the question were mainly focusing on rice, but I think what I'm going to say about rice could also apply to the other staples, obviously. So as I shared earlier, I think one of the most critical action that we need to do really together, I mean, working public-private sector, is to ensure that we can safeguard the access to affordable and nutritious food. Meaning that fortified food, including rice in that case, has to be made accessible to people who need them the most, meaning looking at social safety net, but also retail, because I think the question was from someone from Myanmar. And Myanmar, there is no mandatory fortification in place for rice, but fortified rice is available in retail. But we have to keep in mind that it has to remain affordable. So how to do that? Typically, what food companies will respond is that we need scale, meaning the more demand you have, the lower the cost of the product, obviously. But then you have also options, because if you look at the fortification value chain, whether it's rice or other staples, you have premix, which is blended somehow into a fortified food. And typically, if you look at rice, the different cost components are premix, rice flour, and production cost. So if, for instance, we can, premix industry, food manufacturers can work together with the government to ensure that premix could be made available at a more affordable price by removing duties at customs, that could also help to bring down the cost of premix, for instance. So that's really one option. And the question from a gentleman in Myanmar was, in Senegal, sorry, does the fortification of rice impact the total cost of the product? Yes, it does. I mean, the cost, the incremental cost of fortifying rice is typically between 2 to 5%. But again, the higher the demand, the higher the scale, the more the cost will go down. So if we manage to work together to scale up demand through social safety net, through school feeding, the price of fortified staples will go down. And I think a very concrete example is India. The cost of fortified staples in India is lower as well, because of course of the massive demand of a different social safety net. So I hope that answers the question, and I'm available for any further follow-up on that. So
thank you. Thanks very much. Moving to a different topic that was raised in the questions, and to Miriam, you gave this great example about eggs in the marketplace, and the questioner is asking, can you give us more examples of how the COVID response to COVID has actually made children's diets healthier?
Yeah, I would say maybe hasn't made, but it's an opportunity to make. So I think first of all, like you answered you answered the question yourself further on. For me, this is really an opportunity to be working together. And Fatima, you brought this up as well. This isn't about school meals alone, or this isn't about food systems. For me, there's like 5 systems that need to be working together. And this has brought it up. It's about social protection, wash, food, health, and education. There are many more systems that need to be working together, but these are the 5 that we like. This, if anything, COVID for us working in this field has said, actually, we're working in the same area. We're working with the same children. We need to be more aligned in how we do that. I think the other thing that it's really brought out as well for me is a massive advocacy opportunity, about actually putting children and nutrition back on the agenda. I think to myself, just 10 years ago, we had a massive world food price crisis. We've forgotten about that. We've forgotten what happened in 2007, 2008. This is another crisis. It's not the same thing, but we very quickly move on. We move to other priorities. I think about, I'm from the UK. If anyone's followed the news in the UK, there's been a massive thing about what's happened during school holidays. Like, children are back at school, but what happens to vulnerable children when they don't have school meals? This has brought up the massive levels of childhood poverty in a very wealthy country, and this is something that was not being spoken about 6 months ago, a year ago. So I think for us to really think of this as a kind of advocacy opportunity, Yannick spoke a lot about some of the kind of very practical things that need to happen on more of a kind of government institutional level. around trade, around how we protect SMEs and smallholder farmers. I'd also add that we need to think of food systems as essential services. So when we think about lockdowns, like who gets included in those essential services? Anyone working across the food system is part of this essential service, but that needs to be done in a safe way. And you know, we've spoken a lot about food fortification. That's something my colleagues work on, I work less on, but we also need to think about how do we fortify foods for young children. So there's a really large unfinished agenda about fortifying infant foods, but it's also a very different mechanism than fortifying foods for adults. And there's a lot more, you know, quality and safety that we need to be thinking, about. And you know, the one around affordability and how we think about, you know, behavior change. We chose to focus on eggs because eggs were affordable. Like the affordability analysis was done before that. It wasn't just by chance. It was definitely about increasing consumption of animal source foods. So I think for me that whenever we think about anything around social behavior change or nutrition education, we need to link it up with what is actually affordable for people to buy. So I think for me, those are kind of, yeah, I guess some things that I think about some kind of concrete actions going forward that we can take from COVID-19 and the lockdowns.
Thank you very much. I want to come back to the private sector in a minute, but staying on a question, and Fatima, I'm going to ask you about this. One question is that COVID context should really be used as an opportunity to enhance nutrition education and healthcare for children in their communities. And what advice can you give about partnering with the ministries of education, the ministries of health? I mean, I guess I would say I would add to that question, every school feeding operation is partnering with some ministry. So how do you reach out to the other ministry? How do you reach out to the health ministry if your partner is agriculture ministry? How do you reach out to the education ministry if your partner is the health ministry, and whatever, in order to be able to improve nutrition education?
Okay, I will answer this question based on my field experience. One of the most difficult issues that we face in the field is the coordination and the collaboration between the different ministries. This is the bottleneck, because in fact, I didn't have time to elaborate more about findings from previous reports that we had, but policy coherence and getting the different ministries to talk the same language and be on the same page is one of the most important obstacles we find when we are doing implementation at field level. Luckily, with the programs, the school feeding programs, many countries now have accepted themselves that they cannot work alone. So the ministries of agriculture and the Ministry of Education, I would say to a lesser extent, perhaps the Ministry of Health, are coming together to work on promoting local production for improving the school meal content. So it is not an easy. It's not an easy question to answer. Contexts are different. In some countries, we are facing obstacles. In others, we are getting the policymakers to talk together and to agree on planning together. So this is happening. It will take time, but it's a long process. But it's also it's not it shouldn't be top-down approach. It should be really a need that the countries feel, and this is what we are trying to do, and other agencies are trying to do, and the NGOs in the countries are playing an important role. I want to talk about the COVID as an opportunity. In fact, one thing that we have not talked about yet is that those who suffered most from COVID and those who had the severe cases were people with diseases related to diets. So the question of nutrition has become central in the debate of COVID. It's not everybody who is affected the same way. People with diet-related diseases have suffered more. So this brings another meaning to why nutrition should be promoted. Now, how do we promote nutrition and the practices? The COVID itself I am divided about the COVID itself being an opportunity, because it's a shock, yes, but it's going to be short-lived in the history of humankind and the lives of people. What do we learn from it? Not everybody resorted to better eating habits, or to a lot of people don't have the skills, don't have the competencies, they don't know how to eat in a healthy way. So this is another reason for why we want to work on the competencies and the skills, and build that, and work with children from an early age to build these capacities. They are not learned overnight, and not because we had COVID we will be able to choose better. This takes time. So this is actually another reason why nutrition education should be revisited. Information sharing is not working and will not work in the context of COVID or without COVID. We need to work on different skills.
Yes, that's a very, very good point. I mean, no matter what particular piece of this pie we're involved with, we should have as the chapeau nutrition, your point that nutrition related diseases made people particularly vulnerable in this pandemic, and that certainly should take the attention of a lot of policymakers all around. I want to shift in the 5 minutes we have left to the private sector, and by private sector, I first mean I'm going to mean it in two senses, but one is about corporations, companies that sell food, essentially. You know, there's been a lack of communication for a long time at different levels that we've all seen in this sphere between NGOs and some companies. I mean, some NGOs think they're allergic to dealing with it in the private sector. Some private sector people think the NGOs are all crazy people. I mean, I'm maybe over exaggerating, but there's been big gaps in communications. Yet both kinds of organizations are absolutely critical to our achieving success and feeding children. So I wanted to ask if they can give brief answers, if Yannick and Miriam can address this issue, just to make some suggestions about where we go in support of children in the future on this score. And then I want to ask Fatima how FAO deals with this, since it's basically an organization of governments. But I want to then leave time for one more important question at the end. So, and we have 4 minutes left now. So Yannick, please, and then Miriam.
Sure. Thanks, Catherine. And I don't think you're exaggerating at all, actually. I mean, it did exist. There's been historically a lack of trust, a lack of understanding as well between public and private sector. I mean, I'm not answering on behalf of the whole private sector because it's a very diverse group, as you mentioned. But I think now we have a platform like SDG 17, I mean, the Sun Business Network as well, which have really created new mechanisms to really find a way to engage private sector in a meaningful way. And I just want to emphasize that, I mean, given the magnitude of the issue today, I don't think it's an option anymore not to find ways to work together. Cross-sector partnerships are a catalyst to really improve children malnutrition. And I think private sector needs to be a partner and not only a donor. Private sector organization like GSN can bring technical assistance, can bring nutrition expertise. But of course, it's a partner with open mindset and shared goals, duties, and responsibilities as well. And private sector also have to respect fully the rules of engagement. But I think now we have sufficient learnings from public-private partnership. I think we have ground rules, accountability mechanism. So I just think now it's time that we find ways to all get comfortable with these rules so that we can really take action and work together. So,
great, thank you very much. Miriam?
Yeah, so just first of all, thank you for clarifying what we mean by private sector. And I think coming from the NGO sector, we often say private sector. And just thinking about, you know, in sub-Saharan Africa, SMEs account for up to 70% of all food that's produced or sold. So I think we need to be really clear about what we mean by the private sector and also what our discomfort is with the private sector. So I think just very practically, I completely agree with Yannick. Like we can't avoid working with the private sector, especially around food. So I think for me, it's first of all about having principles of engagement. about having a clear understanding as an NGO of what we are willing to engage and not engage on, and what types of large corporations as well. And I think especially around the field of nutrition, there's certain things like the international code on the marketing of breast milk substitutes is a clear one that is like that's a complete no-go in terms of principles of engagement. But I think we also need to be a little bit humble in the NGO sector, recognize there are certain skills and expertise that we don't have that come from the private sector, come from corporations, and that we need to be able to work together. I think there's been some really good lessons from WASH sector, actually. I think the Toilet Board Coalition, I think just for me is always an example I go to of how the kind of NGO and private sector actually work together on the same issue. And so I think there's something there that we can really learn from. But I think if we, for me, it's just the thinking of, we can see something as just part of the problem, but we can also see it as part of the solution as well.
Thanks very much, Miriam. Very briefly, Fatima, because we're running out of time, if you can respond.
Well, okay. FAO is actually promoting a food systems approach to the problems of malnutrition and hunger. So we see the private sector as an actor and an efficient actor in this in the food system transformation. We believe that SMEs have a big role to play in feeding the population, but we are mindful of their limitations.
Un rôle prépondérant à jouer, mais même s'il y a toujours des limitations et certaines contraintes, c'est pour cela qu'il faut travailler sur l'organisation conjointe et les contributions des uns et des autres.
Small farmers are also private sector, but also perhaps when we are talking about private sector, the first thing that comes to our minds is the big industries that have quite a lot of gains to make by selling cheap food. And we believe that we can work together so that there's more social responsibility and more support from the big companies to these SMEs in order to change the paradigm that we have now and to have better nutrition outlook. So we believe we need to work with the private sector as much as with the other sectors as well.
Thank you very much, Fatima. We're about out of time. I know a couple of people have been sending in questions just now, but we're not going to be able to get to them. But several people sent in questions relating to farmers before, and we have not really talked about farmers anywhere near enough in the session. So in the last just minute or two, if we're allowed, I'd like to just get a couple of thoughts about how to better connect the small, especially the smallholder farmers, which some questioners talked about being very vulnerable. Of course they are, with school feeding programs, and how can we do a better job making those connections? And I'd like to ask any panelists if they have very, very quick examples of how this might work. But I'd like to give one myself too. In my own community, which is a rural community in upstate New York, there's a group called Seven Valleys Health Coalition, and I think they do a marvelous job at surveying the farmers, finding out who has something to sell or who might have something to sell, surveying the different outlets that distribute food, especially during COVID, and then connecting the two, and if necessary, then with other agencies, finding the resources to buy the food from the farmers to give it to the others rather than have it all go to waste. Those kind of systems are what we need to develop if they don't exist already, I think, and schools as a regular user of resources are a critical potential buyer, and also a reliable buyer, at least in terms of the needs of the school, if only there's some resources involved. So I wonder if we could just quickly go from Miriam to Yannick to Fatima, and we're already over time, but just to have a few half a minute of thoughts about this would be great. Miriam.
So just very quickly, I think it's for me thinking of, in the same way we think about protecting like SME owners, we need to be thinking about smallholder farmers in the same sentiment. I'm thinking, from food systems rather than just about nutrition. It doesn't start once we have a product and once we start consuming, but actually what goes in at the farm level. And finally, we haven't really talked about biofortification. I mean, that's a whole other field, so we don't need to go into it. But, you know, I think biofortification for me is a big one as well, which is, you know, how do we get biofortified foods onto, you know, onto school menus? And that for me is like a very clear link between, you know, protecting smallholder farmers and improving the quality of school meals as well.
Thank you. Yannick?
Well, I mean, I just want to take an example. Well, so DSM has invested, well, together with donors, IFC, FMO, and others, in Rwanda, in a facility called Africa Info Food. And here the idea was to use locally grown raw materials, in that case maize, to really support local farmers. And here, I mean, the factory today is making nutritious porridges, which are supplied to WFP and the government, targeting 1.5 million children, and working locally with 35,000 local farmers. So it's pretty much, I mean, feeding Africa from Africa. So if we can have more of this business model expanded, replicated, I think that would be really something which could have an impact. So
good, thank you so much. Thank you, Fatima.
Actually, the example I would like to give here is the homegrown school feeding. FAO is supporting the homegrown school feeding, and that is purchases from the smallholder farmers to the school meals. Also, as Yannick said, Feeding Africa from Africa is also one of the programs that we have been supporting. So we are doing it this way.
Great, that's a good example and a great way to end. Again, we're here in support of the people who labor every day to try to ensure that children are fed at school, or if they're not in school, that we find innovative ways in order to be sure that we're feeding school-age children. So I know all of us on the panel want to salute all those people listening who are doing this amazing work all around the world, and wish you all the best in your creativity, in your strength, in your success in reaching even more children and with more nutritious food and helping to educate them for the future. So thank you all, everybody involved in the Global Child Nutrition Foundation, and a special salute to Jean White, who created this, and to Arlene Mitchell, who's been the leader of the program for such a long time. It certainly is my hope in the future that we'll be able to highlight, as Fatima said, the importance of nutrition, and then in such cases we could look again at GAIN organizations like the Global Alliance for Improved Nutrition, and how they can help spread the word to even more people around the world. And then when we have people as involved as Yannick and his organization, his company, that can give us some good, actually on the ground experiential background that could be useful. If we could combine all these types of thoughts, we could have great success in the future. So thank you all very much. Thank you to the panel for all of your thoughtful ideas. Thank you, Ryan Kennedy, for bringing us together, and good luck to all of the listeners and participants in the conference and in the future. Thank you very much.
Thank you. Bye-bye.
Thank you.
Thank you so much, Catherine, for that wrap up there. And as just some final housekeeping notes for all of our participants that stayed with us to the end of the session. Just like to remind everybody that the session presentations and notes will be available to participants in the follow-up email. And as we've had so many great questions and points from our panelists about the importance of integrating with WASH, of health and hygiene, of finding ways to speak the same language as we look for opportunities for advocacy and cross-sectoral collaboration. I think this all points us into the further opportunities that this forum will present, opportunities to join our health and hygiene workshops that will be beginning next week. Later this week, Yannick and his team, in collaboration with Harvest Plus, will be starting off their series of workshops on biofortification and fortification, where those of you who have posed those questions in today's chat will be able to take those learnings a level deeper. And this very afternoon, we start our funding and advocacy workshop series, which you guys can all join and do some engaged collaborative exercises about ways that we can find those shared messages and find ways to speak the same language. And for those of you that are passionate about the pursuit of this opportunity for advocacy, I encourage you to stop by one of our collaborative communique drafting sessions and make sure that your thoughts and opinions are brought together into this communique document, and that it can be an effective tool for us to navigate what looks to be a challenging year ahead. So just to thank you on behalf of the Global Child Nutrition Foundation, to our panelists, to our esteemed moderator, and to all of our incredible participants who have stayed with us today. And we look forward to seeing you further throughout this event. Thank you so much.